I've got a fair few slides to get through, and I'd suggest you have a look at them afterwards because I'm going to go through quite quick and focus on the practical actions. So we go to the next slide. Now, this is a really good piece of work sponsored by Impact on Urban Health. And I think, sorry, back a slide, please. Go back. Okay, perfect. And it shows the real impact on real people in their homes in Southwark. Southwark's quite similar to Lambeth, quite similar to a lot of your boroughs in terms of high density housing, people living in overcrowded housing. So you can see for some people, the houses actually become unlivable, Lambeth, which is spurring us to do some research work. So next slide, please. Right, this is a project we're doing this summer, which we're calling Cooling Five Ways, which focuses on North Brixton, which is an area where we know we've got communities suffering from deprivation and an urban environment that's extremely susceptible to overheating, with people that may be struggling to cope with that. So this summer, we're going to recruit around 60 households and give them what we're calling cool kits, which includes energy vouchers, electric fans, temporary blinds, cooling mats, water bottles, thermometers, and we'll also be giving them a package of support and coaching to help them use these things to stay cool, but more importantly, from our point of view, to actually understand what works and what doesn't work with the communities that we are focusing on. The other thing we're going to be doing is attending events in the North Brixton area to try and raise people's awareness of heat, the risk it poses and what they can do. And we're going to try and get an insight into people's actual lives in the community and whether the UK HSA advice is actually practical for them. And if it isn't, what we can do to make it work better. So next slide, please. Oh yeah, this is a good model that one of our academic partners found for us about heat risk. And one of the important things to say is not everybody will be impacted equally. You'll get periods of weather where if you're fit and you're healthy and you're young, you may actually just find it quite good fun. But in that same period of weather, if you're older, if you're ill, if you're living in a house that's subject to overheating, you might be getting to dangerously hot conditions. So when we look at heat, we look at these three dimensions. How exposed are you to it? How vulnerable are you to it? And what's your capacity to take action to cool yourself down? So next slide, please. Next slide. Right, exposure. This is one of the estates we're going to be working on in North Brixton. I'm not sure if you can see from the picture, but very little greenery, mostly concrete and tarmac, and it creates almost a walled garden on the estate, which traps heat day and night. So that's the kind of area we're going to be focusing on. Say if you're an elderly person or somebody with a long-term health condition living in one of those houses, you're probably going to be very, very exposed to heat, and you're going to find it difficult to find an area nearby where you can go to cool off. Right. Next slide, please. This is a tool that I suggest you look at. It's the London building stock model. It's really good. It will allow you to look literally at the level of an individual address, a flat or a house, to see whether they're going to be exposed to heat risk. You can also look at it in terms of deprivation. So I'd advise you to look at that if you're starting to plan your interventions around supporting people in summer. Next slide. This is the kind of stock stuff that many of you will be aware of in terms of who's vulnerable. It's people aged over 65. As you go over that age, you become exponentially more susceptible to heat illness. Pregnant women and children under 5, physiologically, for the women, their bodies are having to work that much harder. So heat stress adds an additional layer onto that. For the young children, their bodies are just not capable of cooling down in the same way that an adult is. So they need attention. And certain long-term health conditions like breathing problems, heart conditions, kidney disease, and also people with mental health problems. Sometimes the drugs they're on, sometimes the conditions make them particularly susceptible. So next slide. There are other aspects to vulnerability that we're starting to uncover in some of our work and focus groups that are not so obvious. The first one is social isolation, which when you look at the research from America and some other countries where they've had higher levels of heat fatalities, when people become socially isolated, they're much less likely to get warnings, they're much less likely to get help, and they're much less likely to be found if they're in distress. So that's something to really look at. People in your community that are socially isolated. Another issue is learning difficulties, that often messages around heat health and heat mitigation can seem quite complex, contradictory, difficult to understand and apply. So people with learning difficulties are much less likely to get those messages and engage. The other one is maybe more obvious, is mobility, that if you're struggling to get out of your house, then you're going to struggle to escape the heat in that house. So whereas somebody who's able-bodied might get out, find some cool space and cool down of an evening, if you're very old, very infirm, you're going to be stuck. And the other aspect is lack of money, as in things that other people might do to cool down, like buy a fan, run a fan, cold drinks, getting out to cool spaces are not available to everybody. So next slide. So adapted capacity is just your capacity to actually actively do something. So the number one thing we're finding with our communities is money. Not many people in Lambeth are going to be able to afford air conditioning. They may not be able to afford to travel by car, so they're on public transport. They may not be able to afford basic things like window blinds. They don't have the kind of accommodation that has a nice shady garden. They're often living in overcrowded accommodation. Often people on low incomes can't change their work patterns. They have to go into work at the hot part of the day. They have to travel on public transport at times when it's at its worst. And often they don't get access to cool spaces, as in either they're not nearby or they can't afford the admission fee to a cinema, a restaurant, or some other kind of space. Next slide, please. The other thing with the adaptive capacity is fear of cost. We found that people are frightened to even run an electric fan. I've even heard cases of people being so worried about the electricity bill that they've turned their fridge and their freezer off. We've got issues of countercultural behavior. We're asking people to close their windows and doors and put curtains up in the height of the day to stop heat coming in. That can be countercultural. We're asking them to keep the windows and, if possible, doors open at night. Again, countercultural. There's a learning process here. Mental health again. People with mental health problems can struggle to change behaviors. They can struggle to engage with other people outside their house and their community, and that can mean messages are difficult to get to them. And then the other aspect is overcrowding, where in Lambeth, I think we've got one of the highest percentages of people in temporary accommodation from homelessness. These are often poorly adapted, overcrowded environments, and you've got, multiple families often sharing one dwelling because of housing problems. So that creates problems. And I'm at the end of my presentation now. I don't think there's question time, but I'll stay on the chat and happy to pick up questions from people after the event. Thank you.